When you first come to see me, that can be a little bit daunting. And so I just wanted to go through a few different things so that you know exactly what we're looking at and how I might be able to help you during that initial consult, so that you bring everything and make sure that you're going to have as much of a, encouraging, supportive, positive experience as possible. So first of all, I go through the history of a concern. What have you done previously that's brought you here? What is your pain? When does it happen? Why does it happen? All of this information is really critical. What does it feel like? Where exactly is it and where might it radiate to? These are all the things that I want you to have a bit of a think about before you come through. Is it worse in some shoes rather than others? What have you trialed before? And that's a really important aspect as well, because if ice and heat work or changing your shoes or custom orthotics, then that's information that I need to know as well. We'll also go through your medical history, anything from diabetes and asthma through to inflammatory conditions like psoriatic arthritis or rheumatoid arthritis. I do want to know all of that, and I want to know what medications you might have and any allergies. Most importantly, if we do proceed to surgery, I want to know how you've tolerated previous procedures, whether you've even had a local anaesthetic or a general anaesthetic, and whether you recovered well following that. Bringing all of that together, I want to have a bit of a look at your imaging. Now, if that's undertaken at one of my local imaging places, then I'm able to access that online. So don't be too worried about finding the films that you might have had. But if you can let my staff know beforehand of exactly where that was, then I'll be able to pull that up. And that's a really good way to go. But after having a bit of a look at all of this and having a bit of a chat and getting to know you and what's impacting you, I'm then really big for goal setting. I want to know what you can do now, but also where you want to go. Whether you're going on a European holiday and need to walk an hour and a half, or whether you just want to be able to go do your grocery shopping without pain in your feet. Now, we talk about SMART goals, and these need to be specific and measurable. And so where I'm going to be looking at is, okay, well, how far are you going now? How far do we want to go? And making that as realistic as possible. We then want to put a bit of a timeline on it. And I typically say to my patients, if we're doing everything that we can, I would hope that we'd have about a 50% improvement in pain over the next month. Now, sometimes that can be quite optimistic depending on your concerns, but I'll give you a bit of a guide there. But the most important thing to me is that we do have a goal. Now, when we go through having a bit of, all of this prelude type of information, I then need to have a bit of a look at you moving and how you're moving and make sure we've got the right diagnosis. Now, to do that, what I need to do is see you walking as part of our assessment. I'll then move your feet around and check the range of motion of your joints. We'll then see where your muscle strength is. We'll also potentially do a nerve and blood flow assessment, as well as a bit of a palpation or push on where your pain is. Sometimes I'll even do a clinical ultrasound in rooms. Now, all of these type of things are going to hopefully lead me to understand what's causing you pain and what your diagnosis is. Now, it's really easy to treat something if we do have a diagnosis, but we can't always find a diagnosis, or there may be multiple diagnoses that can really make things difficult. And so once we are able to assess and find out where our pain is, say that there might be a diagnosis and what that actually is and how it means, and I like to try and explain this in as much depth as possible, we then need to say, great, but how do we fix it? And that's where I want to start your care planning. Now, you can see on the screen here that there's a bit of a personalised treatment plan. Now, this is a two-sided document that I give to all of my patients, and that allows me to highlight and write down any extra information or your actual treatment plan, because it's really important that you understand, and I know these consults can be quite demanding, and this is why, I want to give you as much information that you can reflect on later. And that's why I've got these videos as well, so that you can then see beforehand and after the fact of what we're going to be looking at. Once we've got a bit of a treatment plan, we need to start putting that treatment into place. And those different treatments could be a number of different things. They could be cutouts in your shoes, they could be different shoes, they could be different lacing techniques, there could be some laser therapy, some injection therapies, not only steroids, but different prolotherapy therapies or platelet-rich plasma. But then there could also be shockwave therapies. There's quite a lot there. Some of the time, and particularly if you haven't had imaging, I might need to get some more imaging or, some initial imaging as well. So that could be some ultrasound and x-ray. And that's going to guide me to make sure that we've got the right diagnosis and that we're going to be doing the right things in the right way. And so have a bit of a think about all of this as well. Go through some of my other videos to see what sort of things I might be offering so that you can come to the party and making sure that you know what's happening and inform yourself so that we can straight away get into your treatment as quickly as possible. I do like to trial things during my initial sessions, but of course not everyone will this be appropriate for. And so let's have a bit of a look through some of the other things in some of our other videos as well. But for the moment, please hit subscribe and let's have a bit of a chat. Give us a call, see what we can do to help you further. But for the moment, it's been really good chatting.